The nurse cares for a patient with a urinary tract infection, UTI. The patient has an allergy to penicillins. Which of the following medications is contraindicated for this patient's illness? A. Streptomycin. B. Clindamycin. C. Sulfasalazine. D. Ceftriaxone. E. Ciprofloxacin. The answer is D. Ceftriaxone. Patients with allergies to penicillins often have cross-allergies to cephalosporins. Cephalosporins such as ceftriaxone should be avoided by patients with these allergies. Patients with cephalosporin allergies should also avoid penicillins. Streptomycin, ciprofloxacin, clindamycin, and sulfasalazine may all treat UTIs but are not penicillins. The nurse assesses patient medications at a primary care clinic. Which of the following patients with osteoporosis should not be prescribed alendronate? A. A 70-year-old female with chronic kidney disease. B. A 62-year-old female on a low-calorie diet. C. A 65-year-old female who is allergic to iodine. D. A 58-year-old female taking estrogen. E. A 53-year-old female taking captopril. The answer is A. A 70-year-old female with chronic kidney disease. The nurse should identify alendronate as a medication that slows bone loss, and is commonly prescribed to patients with osteoporosis to maintain bone density. The nurse should assess ages and risk factors associated with both osteoporosis and alendronate use. Alendronate is contraindicated in patients who are allergic to it, have esophageal issues such as narrowing or blockages, are unable to sit or stand upright for 30 minutes after taking, or have kidney dysfunction or low blood calcium levels. Therefore, the nurse should question the order of alendronate for the 70-year-old female with chronic kidney disease. The nurse should also recognize that older patients are more likely to experience problems such as contraindications with medications due to polypharmacy, so the age of the 70-year-old female should concern the nurse. Alendronate is not contraindicated in patients who are on low-calorie diets, and it is not contraindicated with estrogen or captopril. The pediatric oncology nurse talks to relatives of a child with leukemia. The patient's uncle wants to donate blood for transfusion. Which of the following donor conditions would preclude him from donating blood? A. A 200 mg dose of ibuprofen 20 hours ago. B. A history of Crohn's disease in remission 3 years. C. A history of hepatitis C, 4 years ago. D. A previous cholecystectomy 2 years ago. E. A diagnosis of diverticulosis 10 years ago. The answer is C. A history of hepatitis C 4 years ago. Blood donors must be healthy and feeling well to donate blood. They must also be free of blood-borne pathogens such as HIV/AIDS and hepatitis B, C, and D. Diverticulosis, Crohn's disease, a previous cholecystectomy, and a dose of ibuprofen the previous day do not preclude this person from donating blood. The nurse reviews medication orders for a patient with acute gastritis. Which of the following medications is contraindicated for this patient? A. Ibuprofen. B. Propranolol. C. Furosemide. D. Calcium supplements. E. Acetaminophen. The answer is A. Ibuprofen. Patients with acute gastritis experience inflammation in the gastric mucosa. They must discontinue use of drugs that may cause gastritis or inflammation, such as NSAIDs like ibuprofen or alcohol consumptions. Calcium gluconate, furosemide, acetaminophen, and propranolol are not associated with acute gastritis and can be taken safely by this patient. Which of the following high tyramine foods should be avoided by individuals taking monoamine oxidase inhibitors, MAOIs? A. Aged, smoked, fermented, or pickled foods, pork, chocolate. B. Pumpkin, sesame, and sunflower seeds, brassicas. C. Charred, toasted, or roasted foods, glazes, added sweeteners, and syrups. D. Leafy green vegetables, sweet potatoes, tomatoes. The answer is A. Aged, smoked, fermented, or pickled foods, pork, chocolate. Tyramine is an amino acid that is present in many foods, including fermented, aged, or smoked foods, aged cheese, fish, pork, cold cuts, chocolate, alcohol, yeasty breads, peanuts, and beans. High tyramine intake in patients on MAOIs can cause hypertensive crisis due to monoamine oxidase's role in tyramine breakdown. Patients taking which of the following antibiotics should be cautioned against any alcohol consumption? A. Mupirocin. B. Neomycin. C. Penicillin. D. Metronidazole. The answer is D. Metronidazole. Drinking alcohol while taking metronidazole can result in nausea, vomiting, flushing, and tachycardia. This is due to metronidazol's inhibition of acetaldehyde dehydrogenase, the enzyme responsible for acetaldehyde catabolism. Reduced function of acetaldehyde dehydrogenase results in toxic levels of acetaldehyde in the blood. Monoamine oxidase inhibitors, MAOIs, should not be combined with foods that contain large amounts of what monoamine? A. Synephrine. B. Tyramine. C. Histamine. D. Epinephrine. The answer is B. Tyramine. Tyramine is normally broken down by monoamine oxidase. Monoamine oxidase inhibitors prevent the breakdown and removal, leading abnormally high tyrosine levels in the body. This can in turn displace the storage and increase release of multiple other catecholamines, including dopamine, epinephrine, and norepinephrine. This increase in free catecholamines can cause a hypertensive crisis. You are the nurse taking care of a patient who is being discharged on warfarin for a pulmonary embolism. Which of the following statements would you most likely give when counseling the patient about warfarin use? A. You can participate in all physical activities, including contact sports, while taking warfarin. B. You have an increased risk of seizures while taking warfarin. C. Your risk of bleeding events is not significantly elevated while taking warfarin. D. Do not consume grapefruit juice when taking warfarin. E. You can discontinue taking aspirin, if you were already taking aspirin, while you are taking warfarin. The answer is D. Do not consume grapefruit juice when taking warfarin. This advice is correct because warfarin is metabolized and inactivated by the cytochrome P450, CYP450, enzyme complex, and grapefruit juice is an inhibitor of CYP450. Therefore, when grapefruit juice is consumed, the efficacy of an activation of drugs, like warfarin, is impaired, which increases the effective level of warfarin circulating in the patient's blood. Consequently, even if the patient is taking the prescribed dose of warfarin, the effect of the drug may be greater than intended if taken with grapefruit juice, which can predispose to dangerous, potentially fatal bleeding effects. Thus, avoiding grapefruit juice while taking warfarin is the most appropriate advice for this patient. The patient's risk of bleeding events is elevated while taking warfarin, even without consuming grapefruit juice, though the benefit of preventing future blood clots and pulmonary emboli outweighs the risk of bleeding. Due to the risk of bleeding events while taking warfarin, it would be inappropriate to advise the patient to continue participating in contact sports. Warfarin is not known to cause an increased risk of seizures. It would be inappropriate to advise a patient to discontinue taking aspirin while on warfarin unless explicitly instructed for a medical reason by his physician. While aspirin is an antiplatelet agent, which can predispose to bleeding, and warfarin is an anticoagulant, which also independently can predispose to bleeding, each medication has a clinical indication in the patient, and therefore it is inappropriate to simply discontinue one medication. You are counseling a new patient about initiating a combined oral contraceptive pill, OCP. You know that certain medications can affect the metabolism of OCPs. Which of the following medications could alter the metabolism of OCPs? A. Ciprofloxacin. B. Docusate. C. Lisinopril. D. Fluoxetine. E. Aspirin. The answer is A. Ciprofloxacin. This choice is correct because the combined oral contraceptive pill, OCP, is metabolized and inactivated by the cytochrome P450, CYP450, enzyme complex, and ciprofloxacin, a fluoroquinolone antibiotic, is an inhibitor of CYP450. Therefore, when ciprofloxacin is taken, the efficacy of an activation of drugs, like OCPs, is impaired, which increases the effective level of OCPs circulating in the patient's blood. Consequently, even if the patient is taking the prescribed dose of OCPs, the effect of the drug may be greater than intended if taken with ciprofloxacin or other drugs that inhibit CYP450, which can make the potential adverse effects of OCPs more likely to occur, or occur with greater severity than if that patient had not taken ciprofloxacin with it. Neither lisinopril, an ACE inhibitor, fluoxetine, an SSRI, docusate, a stool softener, nor aspirin, an anti-inflammatory, antiplatelet agent, appreciably induce or inhibit CYP450, and therefore none of them has an appreciable effect on OCP metabolism. You are the nurse taking care of a patient taking warfarin. Despite taking the prescribed dose regularly, the patient's international normalized ratio, INR, is persistently subtherapeutic. You ask the patient if they take any other medications. The patient is most likely to be taking which of the following medications? A. Cimetidine. B. Gemfibrozil. C. Erythromycin. D. Cnidin. E. St. John's wort. The answer is E. St. John's wort. Warfarin is metabolized by the CYP450 enzyme complex, which is known to be induced and inhibited by a variety of other common medications, supplements, and foods. Since this patient's international normalized ratio, INR, is subtherapeutic, meaning that warfarin is not achieving a great enough effect. This should raise the possibility of increased metabolism of warfarin by CYP450, which means that warfarin will be inactivated more quickly than usual. The only agent listed that is known to induce or activate CYP450, which would speed the inactivation of warfarin, is St. John's wort, an herb commonly used for antidepressant activity and anti-inflammatory activity. Gamfibrozil, quinidin, cimetidine, and erythromycin all are inhibitors of CYP450, not inducers, and therefore would slow the metabolism of warfarin, increasing the effective circulating dose of warfarin, which would raise the INR. Therefore, these are not correct answer choices for this case. You are the nurse taking care of a patient being treated with metronidazole for a lower gastrointestinal infection. Which of the following instructions should you give the patient? A. Do not eat spinach when taking this medication. B. Do not consume alcohol while taking this medication. C. Lie flat for 30 minutes after taking this medication. D. Do not take your cholesterol medication when taking this medication. E. Avoid operating heavy machinery while taking this medication. The answer is B. Do not consume alcohol while taking this medication. In this question, what is really being tested is your knowledge of side effects, interactions with metronidazole. One of the major interactions to be aware of with metronidazole is that it can cause an unpleasant interaction when consumed with alcohol that is very similar to the symptoms that occur when one consumes alcohol while taking the alcohol deterrent, antabuse. This reaction includes severe abdominal pain, cramping, nausea, vomiting, facial flushing, and headaches. Patients should avoid drinking alcohol while taking metronidazole and for 3 days after completing their course. Eating spinach, lying flat for 30 minutes after taking metronidazole, taking cholesterol medication while taking metronidazole, and operating heavy machinery while taking metronidazole are inappropriate recommendations, as there are no known direct associations between metronidazole and spinach consumption, head elevation, cholesterol medications, or level of consciousness. What is the most common vitamin deficiency seen in patients taking metformin? A. B6. B. K2. C. D. B12. The answer is D. B12. B12 deficiency is common in patients on metformin, and should be monitored and supplemented either sublingually or intramuscularly. A male client is receiving 150 mg of gentamicin every 8 hours for a soft tissue infection. The nurse giving this medication is aware there are several serious side effects associated with gentamicin, including ototoxicity. Which statement by the client indicates that he may be experiencing this serious side effect? A. I am feeling nauseous. B. I have a metallic taste in my mouth. C. There is a severe rash on my neck and chest. D. I have a high-pitched ringing sound in my ear. E. I am having difficulty swallowing. The answer is D. I have a high-pitched ringing sound in my ear. The ringing in the ear is tinnitus, which is indicative of ototoxicity. Nausea, metallic taste in mouth, difficulty swallowing and skin reactions are not associated with the development of ototoxicity. Which of the following is the most serious potential adverse effect of enalapril? A. Low blood pressure. B. Angioedema. C. Dry cough. D. Nausea and vomiting. The answer is B. Angioedema. All of these are potential side effects of ACE, angiotensin-converting enzyme, inhibitors such as enalapril, but angioedema, the swelling of the face, lips, and/or tongue, is a potentially life-threatening condition, as swelling can obstruct the airway. Which of the following is a symptom of digoxin toxicity? A. Rash. B. Mood swings. C. Tremor. D. Nausea, vomiting, and diarrhea. The answer is D. Nausea, vomiting, and diarrhea. Nausea, vomiting, and diarrhea are common symptoms of digoxin toxicity. Other symptoms may include confusion, anorexia, irregular heartbeat, and palpitations. Tremors, mood swings, and rash are not generally seen with digoxin toxicity. A 19-year-old client presents to the emergency department explaining that he has a history of sickle cell anemia. He is complaining of severe pain in his arms and legs. The nurse recognizes that the patient is experiencing a sickle cell crisis, and is going to administer pain medication as ordered. The nurse is aware that which of the following pain medications is contraindicated for this disorder? A. Morphine. B. Hydromorphone. C. Ibuprofen. D. Fentanyl. E. Mepridine. The answer is E. Mepridine. Mepridine is contraindicated because in high doses it can form a toxic metabolite that can lead to seizures. All other drugs listed are appropriate for pain control for sickle cell crisis. Which of the following best describes extrapyramidal side effects? A. Nausea and vomiting, diminished consciousness, disorientation. B. Altered color vision, altered taste sensation. C. Cutaneous flushing, hypertensive crisis, tachycardia, sweating. D. Dystonia, tremor, slurred speech, restlessness and anxiety. The answer is A. Dystonia, tremor, slurred speech, restlessness and anxiety. Extrapyramidal side effects generally present as slow or repetitive motions or postures, dystonia, spasm, tremor, slurred speech, slowed thought process, restlessness and anxiety, paranoia, and general overall distress. These effects are caused by antipsychotic drugs that act as dopamine D2 receptor antagonists. Which of the following drugs would be least likely to cause extrapyramidal side effects? A. Bupropion. B. Haloperidol. C. Alprazolam. M. D. Fluoxetine. The answer is C. Alprazolam. M. Extrapyramidal side effects are common with typical antipsychotic drugs that act as dopamine D2 receptor antagonists. These include many selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, and norepinephrine dopamine reuptake inhibitors, NDRIs, as well as antiemetics such as metclopramide. Alprazolam is a benzodiazepine and is not associated with extrapyramidal adverse effects. Which of the following medications is associated with increased risk of SIADH, syndrome of inappropriate antidiuretic hormone secretion. A. Drospirenone. B. Chloropropamide. C. Azapoxalone. D. Metronidazole. The answer is B. Chloropropamide. Chloropropamide, an antidiabetic medication in the sulfonylurea class, has been associated with drug-induced SIADH, syndrome of inappropriate antidiuretic hormone secretion. This is a rare but serious complication that will generally resolve once drug treatment has stopped. None of the other drugs listed are associated with this side effect. Which of the following medications can cause the benign side effect of causing an orange-red tint to urine and tears? A. Metronidazole. B. Clindamycin. C. Rifampicin. D. Vancomycin. The answer is C. Rifampicin. Of the drugs listed, the only one associated with this bizarre side effect is rifampicin, a broad-spectrum antibiotic used in tuberculosis. Urine, sweat, saliva, or tears may be turned any shade from red to reddish orange.